All right, good afternoon and hello everyone and welcome to today's webinar. Super excited to have you all joining us today. My name is Jacob Borkover here with the webinar team at Rectangle Health and really just want to thank you all for taking time out of your busy days to be here with us. So we've got a great presentation for you, winning strategies to tackle your patients' financial concerns with the great Steve Anderson, who's been gracious enough to give us his time today. So before we jump into things, want to just give you a little bit of housekeeping here so that we're all squared away before the presentation. So this is a 1 CE credit course. We are accredited, PACE accredited through the Academy of General Dentistry to provide CEs. So if you are on for the duration of the webinar and you answer our polling questions as you're prompted, you will qualify for CE credits. We will be sending those out within 2 weeks from today. So be on the lookout in your inbox. That'll come from someone on our webinar team. So just be on the lookout for that. If after 2 weeks you don't see that in your inbox and you attended, please just reach out to us and we will be happy to get you taken care of. Just know if you are joining us on mobile today, it is a better experience on desktop. So if you're near a computer and can get to one, that would be great, especially for answering those polling questions. And then at the end of the webinar, you're going to be prompted to take a brief survey. Please do that. That's really helpful for us so we can continue to learn. Get feedback on other topics you may want to see, feedback for Steve in the presentation and everything in between. So when you're prompted to do that at the end, please make sure you're doing that. And then we've got a really exciting HIPAA and cybersecurity webinar next week. It's on September 21st at 8:30 Pacific. I'm going to put a link to register in the chat here, so you have that. That'll also be included in your follow-up email. We'd love to have you join us, and we're getting towards the end of the year, so if you haven't done a HIPAA training yet, I highly recommend joining us. Terry from our team does a great job with that presentation. Last thing, I always get asked, will you send out the recording? Will you send out the slides? Yes, we will. Be on the lookout in the next 24 hours in your inbox, and you'll see that email with all the follow-up resources, recordings, slides, link to book a demo with our company, ebook, and everything else. So with that, I am very excited to introduce Steve Anderson. Stephen J. Anderson has been named Dental Businessman of the Year by Excellence in Dentistry. He is a founder of Total Patient Services Institute, Crown Council, and the Smiles for Life Foundation that raised nearly $50 million for dental and children's charitable projects around the world. He's a great friend of ours here at Rectangle Health. And Steve, thanks for taking the time today. And with that, I will send it into you.
Thanks, Jacob. Great to be with everybody today. Happy Tuesday. And we're going to spend the next few minutes dealing with some of the biggest challenges that you face every day, which is talking to your patients about their money. So I'll give you some great tips here, as well as make sure you stay tuned for the entire presentation. We've got some amazing resources that you'll be able to download that will help make your financial presentations that much more effective. So today's webinar obviously sponsored by Rectangle Health. I'll share with you some resources that they provide in this area today. As Jacob mentioned, I am the founder of the Total Patient Service Institute, which is an education coaching group that specializes in the highest level of patient service and case acceptance skills in healthcare. And I'm going to share with you some of those skills today. We are embedded in practices all over the country. And so it helps us to keep a pretty good pulse of what's going on in healthcare as we deal with thousands and thousands of patients all over the country on a coaching basis. Also a co-founder of the Crown Council, which is a network of high-performing dental practices all over the United States that are committed to creating a culture of success in their practice. So in all, we're plugged into thousands of practices every day, which gives us kind of a unique view. And that view I'll share with you today in terms of things you can do to help your patients have a better experience and accept the kind of treatment that you know and that they know that they need. All right, so if you had to think of the most common objections that you hear from your patients on a regular basis, even every day, what would be some of the most common financial objections that you hear from your patients? And if you're like most, you hear things like this. I need to think about it. Now, do they ever think about it? they never think about it. When was the last time you had a patient that called you up and said, you know, I've been thinking about all that treatment you recommended, and I've decided I'm going to move ahead? It might happen every once in a while, but very, very rarely does that ever happen. How about this one? That's more than I was expecting. Won't my insurance cover all of this? Because my insurance covers 100%. That's too much money. I can't do that right now. And on and on. If you were to list all the different financial objections that you hear, it's every day that you hear these. Now, so here's my question. If you had a condition that showed up in the lives of the patients in your practice on a daily basis that you didn't know what it was or how to treat it, what would you do? Well, my guess, you wouldn't sit idly by and just say, well, there it is again. What are you going to do? No, you do your research. You'd get to the bottom of it. You'd find out what it is, how to diagnose it, how to treat it, and how to cure it. You'd figure it out. And I hold that great patient service skills are the same way. If you have situations that recur on a daily basis, like financial objections, when was the last time that you sat down with your team and you talked about how to address these financial concerns and objections? And if you're like most, it's been a minute since you've done that. And so my challenge to you as we go through what we'll talk about today is take this to your team, sit down and challenge them to learn how to respond to your patient's financial concerns in a productive, positive way so that you can hear yes more often. So as we move through, we'll talk about specifically, I'm going to give you a formula today on how to address these objections more effectively. Let's talk about cost for just a moment, because that's really at the root of what we're talking about. How do you as a consumer determine whether or not something is expensive? And the bottom line is you figure that out by comparison. In other words, if you're shopping, for example, for a car or an appliance or any other item, then you can go out into the marketplace, you can look at different companies that offer different products, and you can price compare compared to the value. We determine whether something costs a lot or not based on comparison. Well, what do people compare the price of dentistry to? Or what do they compare the price overall of healthcare to? And for most patients, they don't have the time to go out and try and cost compare or call up your office and say, how much is this or how much is that? You may get some of those inquiries, but most patients don't have the time, the inclination to really cost compare at the basic level. So if you can't compare, what's the only conclusion that you can come to? Well, and that conclusion is it must be expensive. If I can't compare it to anything, the only conclusion is it's going to be expensive. So you will always, no matter what you charge, you will always be accused of being expensive. I don't care if you cut your prices in half for what you charge, you're still going to be accused of being expensive. So we jokingly say, if you're going to be accused of being expensive, go ahead and just be it, because patients will always say that you are. All right, before we get to objections, let's talk about the toolbox, your financial arrangements toolbox, and what you need in that toolbox to increase your chances of being successful and being effective. First, you have to have the right tools. I'll talk about a couple of those here. And you have to have the right training. And that training is how to use those tools, especially how to use the right verbal tools as you present effective financial arrangements to your patients. So let's talk about the tools. First, internal financial guidelines. This is a document that every practice should have that outlines how you handle financial arrangements in your practice. So it should include the following. It should include what your fees are, not your entire fee schedule, but how you handle fees, how you handle discounts, what discounts are allowed and what's not. Payment timing, when payment is due and for what. payment timing if they have insurance, how that's handled, how their insurance benefits, different payment options that you have, and third-party financing. Those are just some examples of some things to include in your internal financial guidelines. So the idea of your internal financial guidelines is it should be a document that you could hand any team member in your practice. Again, this is an internal document, and they would understand how you address financial arrangements in your practice. So, Jacob, I think we have our first poll question. So everybody on your keyboard ready to answer Jacob's poll. Here we go.
All right. Does your practice have written internal financial guidelines? Yes or no? I'll give everyone about 15 seconds here to get in those answers. Remember, please make sure you're filling out the polling questions so we can track you for CE. All right. And looks like we've have about 70% of you have voted. All right, 65% said yes and 35% said no.
Nice. Okay, great. So the majority do. And what I'd encourage you to do, if it's been a while since you have looked at your internal financial guidelines, go ahead and pull those out. Take a look at if it includes all the things that we've talked about here, as well as more. It should be pretty comprehensive so that everybody in the practice knows how you handle the money, how you handle your patient's money in the practice. All right, next tool is what we call your external financial guidelines. So this is the form that your patients see. Now I've got a number of peeves, and if any of you follow me on Instagram, I do a regular post called Steve's Peeves. And so my Instagram handle is the Stephen J. Anderson. So you can see I posted one today, as a matter of fact. And one of my peeves is the word policy. Nobody likes to be recited the company or the practice policy. So that's a word that we don't use, and I don't like to use it on forms either. And so instead of that, we encourage you to have a financial relationship form. And the reason we call it a financial relationship form is it outlines for your patient what your financial relationship is with each other, what their responsibility is, and what your responsibility is. It's a two-way street. So there's a lot more friendly format in that it outlines, here's what we are committed to do for you. For example, research your benefits as best we can to explain the recommended treatment and the best estimate we have of the financial, your financial commitment to that treatment, and so forth. And then it outlines some of the more specifics about how you handle insurance, what whose relationship insurance really is, that relationship is between them and their insurance provider. But it really goes through and outlines what the relationship is between you, the patient, and if there's insurance involved, where insurance falls in that relationship. So financial relationship form, no more financial policies. All right, so that's another recommendation. Update your internal as well as your external financial policies. All right, so Jacob, we got another poll here.
All right. Does your practice currently have a text to pay option? Yes or no?
So this is something that, if you do, ought to be included in your financial policy and your internal financial guidelines as a way that they can pay, which is text to pay, which is right now hugely effective. The throughput on text to pay in terms of people willing to pay with a link they get through a text message is huge. So there is, if you don't have that option in your financial toolbox, I highly recommend it. It's a great way to help patients pay, especially if they have a remaining balance or even if they're standing right there. It's an electronic way to pay.
All right. Looks like 35% said yes and 65% said no.
Sweet. Okay, so some opportunity there to upgrade some of your payment systems, make it easy for people to pay. And I'll give you a resource here before we're done of a way you can incorporate that. All right, next, let's talk about tools, which is your correct verbal skills. So grab your pencil, pen. We're gonna do a vocabulary overhaul. So at Total Patient Service, we believe that words matter. One word can evoke a picture in a patient's mind, and that picture triggers an emotion, and that emotion influences their decision. Even one word can make a huge, huge difference in your financial arrangements vocabulary. So I'm going to give you some words to eliminate and then words to replace that eliminated word or phrase with. All right, number one, financial policy. I've already talked about this one. We're going to eliminate the word policy and we're going to replace it with financial relationship. Right, so you can update your patient financial policy and make it into a financial relationship with not just their responsibility but also your commitment. Next one, your insurance coverage. Now, I take issue with the word coverage because it implies that everything is covered or that things are covered. Depending on which segment of healthcare you're in, insurance means different things, right? So instead of insurance coverage, we like to refer to it as your insurance savings, right? So especially when we're presenting financial arrangements, I might say, Jacob, so the fee for the investment today for the treatment we've recommended is $1,500. Your insurance savings is $500. And then here's the next verbal skill here. So we're gonna say insurance savings, not insurance coverage. And then let's talk about insurance. A lot of times we hear this in reference to insurance is it's presented as your insurance will only cover. And what's implied here is your insurance is lousy and it's not going to cover very much. So instead of saying your insurance will only cover, we say your estimated insurance savings is because it's always an estimate. Your estimated insurance savings is, and then fill in the blank, right? Whatever that is. So your estimated insurance savings. Here's the next one to eliminate, your out of pocket. That kind of conjures up an interesting image, right? In other words, if I say out of pocket, you think of empty pockets and there's nothing left because you reached over and you took everything out of my pocket. So instead, that's become a normal phrase. I mean, you hear it a lot. And just because everybody does it doesn't mean it's a good idea. So we prefer to refer to the patient's portion as exactly that, your portion. So again, the sequence would be the investment in your health is $1,500. Your estimated insurance savings is $500, which leaves your portion $1,000, right? So those are the key words in how we present financial arrangements. So your portion instead of your out of pocket. All right, when collecting payments, and here is another just quick reminder, always use the patient's name, right? Any way that you can make the experience more personable and personal, the better. So always use the patient's name, especially when you're talking about one of the most important things to them, which is their money. All right, the moment you've been waiting for. Let's talk about financial objections and how you handle those objections. First off, let's talk about some definitions. There's a definition, there's a difference between a condition and an objection. So let's talk about the difference. A condition is a reason for not moving ahead based on a currently existing fact. So this is a irrefutable fact that is a current situation. So for example, if a patient says, I'm broke and I just filed for bankruptcy, well, that's a condition. Doesn't mean they can't pay for it, but it just means that that is a currently existing fact. Now, compare conditions with an objection. Now, an objection is a reason for not moving ahead based on inadequate information. In other words, I just don't know enough to move forward. I don't see the path to move forward to get to the destination that you have laid out for me. So with a little bit more information, we can probably get to that destination. Most patient objections are exactly that. They are objections. Very, very few things are conditions where you just can't move past it. Most things are objections. So we're going to talk about how do you move past the inadequate information piece so that you can inform the patient and help find a solution that'll fit their situation. All right, so here's the formula that we're going to work through. And this formula is guaranteed to give you a better patient outcome than what most people naturally do. And what we naturally do is, if you're not careful, you get into yes, but mode with the patient, right? Or we just cave and we don't say anything at all. If they say, well, it's too much money, I can't afford it, whatever it is, then we just say, well, okay, let us know when you can do it. So this formula helps you explore what the real issue is and then offer solutions that might better fit that particular patient situation. So, are you ready for the formula? There's 5 steps to it. Here it is. The first one almost goes without saying, which is to listen to your patient's objection. Listen all the way through. Don't interrupt. Even if you know what they're going to say, don't interrupt. Let them finish and listen with interest, right? Just a reminder, you have to hear them all the way out. The second step is what we call the cushion. And the cushion is not agreement as much as it is understanding. Let me say that again. The cushion is not agreement as much as it is understanding, feeding back that objection to them, to their understanding. So for example, if Jacob said, you know, that's a lot of money, then my cushion for that might be, so, you know, Jacob, sounds like you're concerned about the investment that we're talking about today, right? In other words, I'm just going to feed it back. So for example, I think everyone watching today looked in the mirror at some point in your morning routine, and at least I hope you did. And the reason you did that, when you looked in the mirror, you saw a reflection. And that reflection then, consciously or subconsciously, you compared to the self-image that you have in your mind of what you're supposed to look like. And then you went to work to make that reflection look like as close as you can to that self-image that you have. And then most people go throughout the rest of their day looking for that reflection in the lives of other people. That's what the cushion is. It's just a reflection of what the person just said. The emotional impact of this is that the other person will say, consciously or subconsciously, they heard what I said, right? They understood what I said. So be the mirror. When you cushion, you're essentially you're being the mirror to feed back to the other person what you heard was their concern. Not that you agree with it, but just that you heard it. Next step in the formula is what we call the question. And the question, what it does is it reframes the actual objection. In other words, we give the patient a different way to think about it. So for example, with Jacob's objection, if he said, you know, that's a lot of money, I'd cushion it and I'd say, all right, so Jacob, you're concerned about the investment that we've talked about today. Am I right? He'll say yes. And then my question would be, I would say, so Jacob, is it the total amount or fitting this into your regular budget that's your biggest concern? Is it the total amount or fitting it into your budget? Which one's your biggest concern? Now, most patients will say fitting it into the budget. So what the question did right there is it changed in the patient's mind, it changed the issue from being big lump sum to spreading it out and fitting it into my budget. That's two different things. So I've changed it in their mind and given them a different way to think about it. And that's what the question does, is it reframes the objection so they can think about it in a different way. Then if he says, well, it's really a matter of fitting it into my budget, then my next step is to answer in the form of a question by saying, I'm going to suggest a solution. I would say, so Jacob, if we could find a payment option, we work with several different third-party payers, lenders. If we could help you find a payment that would work in your monthly budget, is that something you'd be interested in taking a look at? Right, so that's the answer in the form of a question. I'm going to suggest that, and then in most cases he'll say yes, and then finally I'm going to confirm, and then I'm going to say, all right, why don't we go ahead and take a look at several of our different payment options and see which one makes the most sense, right? So listen, cushion, question, answer, confirm. We call that LC Quack for short. So I'd like you to take that formula. We're now going to use that formula and we're going to walk through some of the most common objections and see how this works in practical application. All right, so everybody got the formula here. Listen, cushion, question, answer, confirm. Here we go. Let me just address this real quick in terms of when objections come up. Let me take you to a clothing store for just a moment. And if you saw something in that store that appealed to you and you put it on and you did not have any interest in it, what would you do? Well, you'd immediately take it off, put it back on the rack and move on. But if you had some interest in it, you'd probably start objecting. You'd probably say, you know, are the sleeves long enough? Or does this make me look fat? Or is this color right for me? You'd start asking questions. So questions are a buying signal. Questions are a buying signal. So when patients ask financial oriented questions, that's not an obstacle as much as it is an opportunity. It's a good thing because they're asking questions. So objections are a positive. When you hear them, you should say to yourself, this is great because this is giving us something to talk about and it's an opportunity to move forward. The most common objections fall into these categories, these 5 categories: money, urgency. So money, saving money. Urgency is, you know, do I need to do this right now? Time, in other words, I don't have time to do it. Trust, are you the right person to do this? And then finally, scared or fear. So most objections fall into one of those 5 categories. We're going to talk about the money objections today and how the formula works. All right, so here's the first one. That's way too much money. All right, so way too much money. So how would you respond to this? What's the first step? Listen, right? So you're going to hear them all the way out. Then you're going to cushion. So I would mirror this back by saying you're concerned about the investment. This is very similar to the one that we illustrated. So you're concerned about the investment, am I right? And if they explain more, you're going to keep at the cushion. You're going to keep doing the cushion until you get agreement on what their concern is. So in other words, if they say, well, that's way too much money, and you say, so you're concerned about the investment, and they say, well, yeah, I mean, I've got 2 kids in college, and I'll tell you what, it's like, man, everything is really, really stretched right now. So I'm gonna cushion that. So I'm saying, all right, so your budget's really tight right now. To which they would say, well, yeah. So then my question would be, okay, so I understand the budget's tight. If we could work together to find the appropriate budget, something that would fit within your monthly budget so you could take care of this now and not have to wait, is that something you'd be interested in? Right? So cushion, cushion, cushion. And once we get agreement, yeah, that's my real objection, then we can question if we could if we could do this, if we could find something that would fit into your budget, is that something you'd like to look at? Then the answer would be, we have several different forms of third-party financing. Could we go ahead and look at which one might fit you the best? And then finally confirm is, let's go ahead and get started. All right, so again, the key to this that we typically miss is one, listen, then that cushion that many times will happen over and over again, and then the question, which is to reframe it so that they see it in a different light. All right, here's the next one. That's more than I was expecting. Now this one's different than the previous one. The previous one was, that's way too much money. This one is, that's more than I was expecting. Now what's different about this? This one, the difference is there's an element of emotion in this objection, and that is the word expecting. So in this case, in your cushion, could I suggest that sometimes the best cushion is to reflect back, just like they're looking in the mirror, and use their own words. So for example, if Jacob said to me, wow, Steve, that was more than I was expecting, I might respond with my cushion by saying, expecting? I just turn that word into a question. And then he has to respond with what he was expecting. He might say, well, man, I just came in here. I thought I was just getting a routine exam and I had no idea that all of this was going on and it's just overwhelming and it's just, I had no idea. And so what's the real concern? It's their heads reeling, right? They're spinning because they weren't expecting to have this kind of a conversation. And so what I would say, I'd reflect that back and say, you know, Jacob, I can tell you're overwhelmed. This was a lot to take in, especially when you weren't expecting this kind of information. Am I right? And then he's going to say, yeah, that's exactly right. So here's the key to this. The beautiful thing about the cushion is a cushion done right will give you more information. And when you're done cushioning, you'll get agreement from the patient on what their real concern is. Let me say this again. More important than getting the yes to treatment is getting the yes to what their real concern is. If you can feed it back with the cushion to their satisfaction so that you have agreement with them on what their real concern is, then you have permission to move ahead. So in this case, I'd say, so Jacob, man, you're overwhelmed. This was way more information than you ever imagined. And you're just in a state of overwhelm right now. And he's going to say, yeah, that's right. So then I might question it by saying, would it help if I could break this up into bite-sized pieces in priority so that you can understand what's the most important and the sequence of what needs to happen here? Would that help? And I'm making this up as I go, but I've got to reframe this from overwhelm to understanding, sequence, timing, what makes sense, when I need to do it. And if they say, well, yeah, that would help a lot, then I'm going to answer it by saying, great. Let me map out the 5 component parts of what we've talked about today and the timing and what the benefit is so that you understand what's been recommended here, why it's important, and when would be the best timing to do it. Would that help? Yes, right? So again, the key is cushion it, get agreement, reframe it with the question, and then provide the answer or the options for how you're going to move forward. This one, again, the key is it's that emotion. You got to address the emotion. People make decisions emotionally and then they justify with logic. That's a principle that we teach at the TOPS Institute with all case acceptance. It's all about the emotion. So if you move past the emotion, if you skip over it and go straight to logic, then you create all kinds of problems. You have to deal with the emotion first, and then you can deal with the facts and the logic, not the other way around. All right, next one. I can't afford it. Okay, this begs a lot of questions, correct? A lot of questions because you don't know what that means. That can mean different things to different people. So you're going to listen, then you're going to cushion. So you would do the same thing here is you might say, can't afford it. Or you can default to this. I'm going to give you the default cushion. If all else fails, you can be a great psychologist. So what does a great psychologist do? Right? I'm going to give you a PhD in the next minute here. So follow along with me. You can fold your arms, put your hand on your chin, lean your head back. If you're wearing glasses, you can put them down on the end of your nose and repeat after me. Say, tell me more. Let's do that one more time. 1, 2, 3. Tell me more. So if all else fails, you can be a great psychologist, right? Isn't that all a psychologist does? You sit down, talk for an hour, tell me more about this, tell me more about that. Time's up. We'll see you next week, right? So patient says, I can't afford it. We listen to it, and then my cushion will be, I can't afford it. You can't afford it. Can you tell me a little bit more about that, right? Tell me more. So if all else fails, insert just tell me more to get the rest of the story, because this one can take all kinds of different directions. They might say, I just bought a brand new car and the budget's stretched and I just don't have $2,500. To which then you could say, then you could use the question by saying, so is it the total amount that's your biggest concern, or fitting this into your regular monthly budget? And then if they say budget, then you say, great. Could I share with you several different options, payment options we have, so that we can see what might fit best in your budget? Would that make sense? Yes. And then you can go forward with the confirm and move forward. So again, the secret of this whole formula is in those first 3 steps: listen, cushion, question. If we can isolate the problem, 80% of solving a problem is identifying the problem. Let me say that again. 80% of solving a problem or overcoming an objection is identifying what the real objection is. And rarely is the real objection the first thing they say. Rarely. You have to listen and then cushion and then question, and you may have to repeat that cycle several times to figure out what the real concern is so you can move forward. All right, here's the next one. Do you take my insurance? Now, this is not an objection so much as it is a question that often comes up at the very beginning of a new patient experience, even when they're on the phone scheduling an appointment early on in the patient relationship. So I'm going to give you a new verbal skills for this. So grab your pen or pencil. This one especially works well if you don't happen to be in network with or contracted with a particular insurance. Many patients mistakenly think that they can only go to a practice that's contracted with their insurance, and in most cases that is not the case. So before I give you the verbal skills, I want you to ask yourself, think about the patients that you have that come to your practice that do not have insurance benefits with a company with which you're contracted. Okay, so they're at a network, they're not contracted. You all have patients like that. Why? So why do they come to your practice? If you're not in network, why do they come to you? And if you're like most, you'll have reasons like, well, the relationship we have with them, the quality of care we provide, the attention we give our patients, right? All of those different things of why they come to your practice. Okay, so keep those in mind because we're going to draw on those in just a moment. So let's say you answer the phone and the first thing the patient says is, do you take my insurance? Okay, so the first response would be to find out what insurance they have. So you say, could you share with me who you have your insurance benefits with? And they say XYZ company. And let's say it's a insurance company. You're not contracted. You're not in network. So the next thing I would say, provided it's a program or a company you're familiar with and that this is true, I would say, well, thanks for calling. You're in luck because we have a lot of patients who have benefits with XYZ company. Again, you can only say this if it's true. So we have a lot of patients who have benefits with XYZ company that come to our practice. We don't happen to be contracted with XYZ because we're an unrestricted provider. Okay, there's a key word. We're an unrestricted provider, which means we can work with all types of insurance. Would you like to know why our patients with XYZ benefits choose our practice? Would you like to know why patients just like you choose our practice? Now, what are they going to say? No, I don't want to know. Yeah, they'll say, of course they want to know. Then out comes your list. What they tell us, what our patients with XYZ insurance tell us is they come to our practice because of our quality of care, our exceptional patient service, and in addition, we research all of our patients' benefits and help them file their claims to do everything we can to help them maximize their benefits. And then I'll go right into scheduling the appointment. Would a Monday or a Wednesday be better for you to come in for your first visit? Okay. So again, it's how you reframe this. This doesn't exactly follow the formula, but when you reframe the proposition to help them understand better what their options are. So we have a lot of patients who have your same insurance, provided that's true. And we don't happen to be contracted with that particular company because we are an unrestricted provider, which means we can work with all types of insurance. Would you like to know why our XYZ patients choose our practice? What they tell us is because of our quality of care, et cetera, and then once again, move into scheduling the appointment. Now, that won't work all the time, but it will work a lot better than if you say, no, we're out of network, we don't take your insurance. That's a guaranteed not gonna schedule, all right? So how you present things and how you frame it for people so that they understand they always have a choice. Let me say that again. They always have a choice. Help them understand that is you always have a choice of where you go for your healthcare needs. You always have a choice. Next one, will my insurance cover all of that? Right, will my insurance cover all of that? All of everything that's been recommended? So let's run it through the formula. Listen, cushion. What would be a great cushion for this? I might say all of it. I might just feed back those last few words, all of it. Or I might say, so you're concerned about making sure you maximize your benefits, right? In other words, I'll feed it back and make sure that's the real concern. And then my question would be, so it sounds like you want to maximize your benefits so you can minimize your portion. Am I right? Most people will say yes. Then the answer would be, I'd be happy to give you an estimate of what your insurance savings will be so that you have a more clear picture of what your portion would be. Would that help? Right? So, and then so forth. So now, will somebody, you might have a patient, most patients, they will understand presented that way, maximize the benefits to minimize your portion, right? So it sounds like, here's the question. So it sounds like you want to maximize your benefits so you can minimize your portion. Am I right? And most will say yes. For the few who say no, I'm not going to do it unless my insurance covers 100%, then you can respond with this by saying, I completely understand, just so that we're clear with each other, in the event that your insurance does not cover 100%, what do you want to do? Put it on, because it's their responsibility to make the decision what do you want to do if they do not pay for all of it? Okay, so again, back up again, the question is, sounds like you want to maximize your benefits so you can minimize your portion. Am I right? And if they're right, then the answer is, can I share with you what, as far as the best information we have available, your insurance savings, so that you have a better idea of what your portion might be and how we can work together to take care of that. Would that make sense? You'll notice in this formula how many questions there are. It's all about the questions that you ask. Very little telling, a lot of asking. All right, here's the next one. Can I pay this out? So what this means is, will you be the bank? So you listen to it, you cushion it by saying, it sounds like your budget is a concern for you. And they'll say yes, then say, great. If we could take a look at several different third-party payment options, is that something that you would be interested in taking a look at to see what will fit best into your budget? And they say yes, and say, great. Here's the several options. So the shift here is just pointing them towards third-party payment. Not that they're going to pay you, but they'll pay a third party to take care of their treatment. So again, work it through the formula, listen, cushion, question, answer, confirm. All right, Jacob, we got a poll question here.
All right, let's do it. Do you currently have a safe way to store cards on file for your practice? Yes or no?
So this would be, so Jacob, just so we're clear, writing them down in a notebook is not a safe way.
That is correct. That would not be PCI compliant.
Having their credit card number in their patient file is not a safe way. In other words, it has to be an encrypted system where no one would have access to that credit card number except for the credit card processing company, right?
That is correct. All right. It looks like 76% have said yes, they do have a safe way to store cards on file. 24% have said no.
Got it. Okay, so this is not a PCI compliance webinar. For the 25% that did not have, could I highly recommend that you get on that immediately? There are some pretty hefty fines if you're not securely storing patients' financial information and credit card information today. So that's an imperative. If you're handling people's money and credit cards, you got to have a safe, secure way to store it. All right, next one. I need to think about it. We hear this all the time. Grab your pencil, pen. This one's one of the more challenging ones that there is. And if you can master this one, you've mastered the whole lot. So here it is. So you're going to listen. You're going to cushion it by saying, so Jacob, what you're proposing here is very important. With a decision that is this important, you want to give it the proper amount of consideration, right? So I'm going to feed that back to him that, yeah, it's a good idea to think about it. Now, here's the question. This is the pivot point. So Jacob, what patients tell me when they think about a treatment recommendation like this, they tell me that they think about one or more of three things. Do I really need it? Can I afford it? Or is it going to hurt? So what are the three things? Do I really need it? Can I afford it? Or is it going to hurt? Now, of those three things, which one are you going to think about the most? And then he'll choose one of those three. Then we can start over with the formula. I'll listen to that objection. I'll cushion it. I'll question it. I'll work it through the formula again. So the key to this one is you got to give them the things that they're going to think about and let them choose which one is their biggest concern, or let them come up with one of their own. So do I really need it? Can I afford it? Is it going to hurt? Which one of those are you going to think about the most? All right, how about this one? I need to talk to my husband, my wife, my mother-in-law, my psychic about this. We hear this all the time. So here is the key to this. So again, listen, cushion, I'd say, that's what I call the save your relationship plan. It's a great idea to make sure they're a part of this decision. That's the cushion. Now here's the question. Jacob, what do you think she will say? Right? I'm gonna be real clear with the question. What do you think she will say? And there will be all kinds of different answers. They might say, oh, she's gonna tell me to go ahead and do it, but I just wanna make sure I give her the courtesy of weighing in before I move ahead. Or they might say, I know he's gonna be really concerned about the budget because things are really tight right now. Whatever it is, I want to know what they think the potential objection or concern is going to be, and then I can move forward accordingly. So if they say, well, I just want to check in with them just as a courtesy, then my answer would be, totally makes sense. While you're here and it's convenient in that case, why don't we go ahead and get things scheduled so that we have all the details taken care of. And then in the unlikely event that things change when you get home, you can call me and we can make different arrangements. In other words, I'm going to do everything I can to schedule that treatment while the patient's in the office, because if they leave, then we've created a mountain of work on the back end of that to chase them down and to try and get things on the schedule, right? So again, the question, you cushion it, great idea, save your relationship. And then the question is, what do you think they will say? And then you can navigate that accordingly. All right, next one, I can't do it right now. We're coming in for a landing here. Here's one, I'd listen. The cushion for this one is simply the last two words. I would say right now and let them explain. Because the right now is going to have to do with something that has to do with either a budget concern or a timing concern. You got to find out what's really going on. This is an objection that merits more explanation because there's something else going on. You got to move past the front objection and find out what the real issue is. And that's the beauty of the cushion and the question, is it'll help you determine what the real objection is. Okay, so with that, here's my challenge to you. We've worked through a lot of objections this afternoon, and the secret is not what I've said, but the formula that I've shared with you. Listen, cushion, question, answer, confirm. Now, I didn't just come up with that today. That's been a proven formula that we've used with practices all over the country. So my challenge to you is to master the formula, take the objections that you hear, work them through that formula so that you can become very skilled, be even a master at handling those objections. And I'm going to give you a resource for that in just a moment. So here's the key for patient commitment. We know we have arrived at the destination when you have agreed upon treatment, they've agreed on the treatment, you have signed financial arrangements, you have a scheduled appointment, and you have a happy patient. That's what we're shooting for in every patient encounter when we have recommended treatment. This ought to be the final step, is that before they walk out of the office, we have all of this dialed in. And if this doesn't happen, it's usually because we didn't handle the objections that they have properly. So now you have a tool in the objections formula to help you handle those objections properly, to increase your chances of getting to a yes and helping patients get what they really need. So that is the conclusion, the formal education part of our webinar. We have a couple of free resources for you. In addition to this, if you want to pull out your phone and you can open your photo app, you can scan the QR code, and this is what we call the financial objections hack sheet. And what this does is this is just a short form. I've given you the formula today, LC Quack, listen, cushion, question, answer, confirm. This gives you the question piece. That's the pivot point of the formula. So this gives you the question part of the formula so that you can increase your skill in this area for some of the most common financial objections. So you're welcome to scan that, share the formula with your team. This will give you some quick tips on the question part of that formula, the pivot point, so you can reframe that objection in their minds. So that's recommendation number 1. I'll give you a minute to just scan that. You can just fill out the form, and that'll download the hack sheet right there that you can use with your team. Second resource is to upgrade your payment solutions for your practice. We've talked about a couple of those today. The whole payment world continues to evolve very rapidly, making it easier and easier for all of us as consumers to pay for things without a lot of friction. So a great payment solution should reduce your time as a financial coordinator. Shouldn't take a whole lot of your time. In fact, it should be easier and easier today to handle money in your practice with all the tools that are out there. A great payment solution should decrease your accounts receivable because you're collecting more upfront at the time of service. It should be able to cut costs that are associated with paper billing. The days of sending out paper statements should be almost gone. So if you're still sending out paper statements, it's time to upgrade your payment solution. And it should provide a great patient experience. And a great patient experience creates great patient loyalty. So if your payment solution is missing one or more of those ingredients, Jacob's going to put up a link in the chat box, right, Jacob?
Yes, just put it in there.
Perfect. So I'd encourage you to click on that and take a demo of the payment solution that Rectangle Health has developed, high tech, and reduces friction in paying and creates a great patient experience with a lot of solutions in there, including these. You can customize the messages. It does have the text to pay. It has flexible payment options. It does store their credit cards so that they can pay over time. There's all kinds of different options that a great payment solution has. So if that's not something you've experienced yet, I'd highly recommend go through the demo of Rectangle Health's whole comprehensive payment solution. Makes it easier. The easier it is for your patients, then the more success you will have in your financial arrangements efforts. Thanks for joining us today. Make sure you sign up for the demo and the hack sheet that we've offered. And good luck to you as you work through your patients' financial objections at a much higher level now with a lot more skill and a lot more success. Thanks for joining us.
Perfect. Thanks, Steve. And before we sign off here, real quick, just a reminder, we will be sending out the recording, the slides, the link to the ebook. All of that will be coming your way in the next 24 hours. And then be on the lookout for CE credits within the next 2 weeks. And then, of course, please fill out that survey when it pops up here at the end. And as Steve mentioned, if you do want to take a demo of Practice Management Bridge, we have all sorts of different ways for you to collect payments, strategically manage card on file safely, text to pay, and everything else in between. That demo link is in the chat. And then we also have a link to our next webinar, which is HIPAA and cybersecurity, next Thursday, in the chat as well. And those will be coming your way in the follow-up. So with that, Steve, thanks again. Really appreciate you joining us. And to everyone, have a wonderful rest of your day.
Thanks, everybody.